I wanted to discuss, I've been asked this many times in the last week, and it is, why aren't we reporting on what's going on in Yemen? Why isn't there a lot of reporting on what's happening on the ground? I had a news piece go out last week, which I can share the link to after this talk. But really, it wasn't sufficient enough to tell what is actually happening on the ground. And I wanted to tell you guys about the difficulties we are facing as journalists trying to get this message out. I'm relying on a local team in Yemen. The authorities there in the north of Yemen have completely banned reporting on the coronavirus on the ground. And that means anyone who reports on it ends up in jail. And it's quite simply, that has been the case for us. In March, we entered a hospital called the Kuwait Hospital, which is one of the best equipped hospitals to deal with COVID-19 in northern Yemen. My team was able to spend a couple of days there. At the time, there were already cases of COVID-19 in this hospital, even though the authorities in the north hadn't announced the first case of coronavirus. In the hospital, Kuwait Hospital, which is one of the best equipped, one of the doctors told us, and we saw that there are 16 beds prepared to deal with corona. This is the best equipped hospital, and they only have 16 beds with ventilators preparing to deal with patients that will come in with COVID-19. There was treatment already going on, but the authorities hadn't announced any cases. And our sources told us that the first case, patient 0, that entered northern Yemen had actually come from Umrah in Saudi Arabia in early March. So we suspect, and NGOs we have spoken to on the ground suspect, that the virus started spreading in northern Yemen from as early as early March, even though the announcement of the first case took place late April.